Welcome to Emergency Insights. I'm your host, Dr. James Carter. Today, we're addressing constipation. Joining us is Dr. Yang, an expert in emergency and critical care. Dr. Yang, thanks for being here.
Thank you, Dr. Carter.
What is constipation?
Constipation is a condition characterized by difficult, infrequent, or incomplete bowel movements.
How is constipation defined by bowel movement frequency?
Constipation is often defined as having fewer than 3 bowel movements per week.
What are common symptoms associated with constipation?
Common symptoms include straining during bowel movements, hard stools, and a sensation of incomplete evacuation.
What are some potential causes of constipation?
Causes can include insufficient fiber intake, dehydration, lack of physical activity, and certain medications.
Can medical conditions lead to constipation?
Yes, conditions like irritable bowel syndrome, diabetes, and hypothyroidism can cause constipation.
What lifestyle changes can help alleviate constipation?
Increasing dietary fiber, drinking more water, and regular exercise are beneficial.
How much fiber should be consumed daily to prevent constipation?
Adults should aim for 25 to 38 grams of fiber per day.
Are there specific foods recommended for increasing fiber intake?
Fruits, vegetables, whole grains, and legumes are good sources of fiber.
When might laxatives be considered for constipation?
Laxatives may be used for short-term relief when lifestyle changes are insufficient.
What types of laxatives are available?
Types include bulk-forming agents, stool softeners, osmotic laxatives, and stimulant laxatives.
Can long-term use of laxatives be problematic?
Yes, long-term use of some laxatives can lead to dependence or worsen constipation.
When should a healthcare provider be consulted for constipation?
Consult a healthcare provider if constipation is new, severe, or accompanied by other symptoms like abdominal pain or weight loss.
Is constipation more common in certain age groups?
Yes, constipation tends to be more common in older adults.
Can pregnancy cause constipation?
Yes, hormonal changes and pressure from the growing uterus during pregnancy can lead to constipation.
What role does hydration play in preventing constipation?
Adequate fluid intake helps soften stools, making them easier to pass.
Thank you, Dr. Yang. And thank you to our listeners for joining us on Emergency Insights. Stay cool and stay safe.